So we're back with Healthy Living, and my second guest is Terri Johnston. Terri is the Director of Learning and Development for St. Tammany Health System, and she's heavily and actively involved with the St. Tammany Autism Initiative. So I wanted to bring her here today to talk about some things that we do within the health system and some resources we provide to parents. But first, I just want to welcome Terri. So welcome.
Thank you, Amy. Thank you for
coming.
inviting me, and I appreciate that very much.
Yeah, and thanks for being here. I know that your time is valuable, but I think this is time well spent. Tell people, can you tell people who are watching, who are you, what do you do for the health system? How long have you been there?
I have been at St. Tammany Health System for 18 years. I've been in my current role as the Director of Learning and Development for 7 years. So what I do is I make sure that everybody that we hire is ready to be trained and oriented to the 156 departments that we represent.
Wow.
And any annual competencies that are required by any of our governing boards that, you know, anoint hospitals to function.
Fun times.
It is. It's very technical, but it's education-based, continuing education,
and you
safety.
need to have that, yeah.
Absolutely.
But you do have a clinical background. You're a nurse.
Yes, I'm a nurse by trade. Yes,
Yeah.
I've been a nurse for, oh gosh, I think 28 years now.
And you were Nurse of the Year a couple of years ago.
Yes.
Let's just tout that.
Yep.
Congratulations.
2 years
again
ago,
to
I was,
Terri.
yes. I was,
Nurse of the Year, very well deserved.
thank you. I appreciate that.
So we were talking with Sunny about World Autism Acceptance and really autism in general. And her personal connection grew, out of her personal connection grew this initiative that we do now, and it continues to grow. And we touched on certified autism centers and what that means. And then we also talked about what autism is and, you know, neurodiverse children with sensory needs, how we're trying to meet those needs, not only for the parent and the child, but also through our clinicians so that they can provide, you know, that care that is needed. And so for your part, you have a lot of involvement with this. So we have a bunch of tools on the table here. We're going to show them up close in a little while. But what's your role in ensuring that these tools are available and accessible to parents and their families when they come into our clinics?
So I am a proud coordinator. I bring everyone from the pediatric service line, Dr. Sonny McDaniel, communications. I bring everybody that can help us make this real.
Yeah.
Together on a regular basis. We talk, we plan, we make sure our inventory is ready to go, and I keep it handy so I can replenish on as the need is. So, and then we plan for future initiatives and try to stay current.
Keep building on it.
We're trying. We're trying.
You're doing a good job. So we talked about the myriad resources that we have. We have all this online, the videos, and this and that. This is the resources personified, or a slice of them.
Correct.
So let's talk about this one real quick. This is our visual guide. Now, we're going to show you all this up close, but Sunny alluded to this. And this is for parents, right? When they come in, this is a visual guide for their child on what they might see or what they might, you know, need. And this is available online, but this is also in every certified autism clinic that we have, correct?
Correct.
And you'll notice that it's laminated, so it's easily cleanable. It's cleaned very frequently to prevent, you know, germs and things like that. But you mentioned something when we were talking before. It's available on the go. You're going out of town, your child has a health care need, or any kind of need really, pick up that, log on to our website and get that visual guide pulled up on your phone, and
Correct.
you can use it.
Correct. Go to sttammany.health/autism and bring these up on your cell phone, an iPad, any internet connected device, and you can click on Learn More, and this resource guide is on there for you to open up, and you can use it on demand if you're out of town. We also have a little one-page quick guide that comes so that we can very quickly assess your child's need, or even adult who's nonverbal. So, because a lot of our patients, you know, are nonverbal, or they might be scared and really can't talk, and this allows our staff to figure out what's going on with them.
Yeah.
You know, it empowers the patient, not just the parent, to communicate with us. So.
Yeah, so that's kind of like the question, the obvious question is how? How does someone use this? And, you know, you said it helps you to communicate. So what, in your mind, how does that work?
When you come in, and whether you're on the spectrum disorder, just have a deficit, we can just pull this out and say, can you tell me where it hurts? They can point, they can tell us where their needs are. We can do countdowns and go, okay, I need to measure you in 5, 4, and we can point and give you pointers, right? We can tell them that we're going to be taking their temperature on their forehead. We use a lot of forehead scanners, how we might have to check their pulse ox, their oxygen level. So we can do a countdown, which gives them a little, decreases anxiety and stress for the patient and their family, because it's very scary, as everybody knows, to go to the doctor, much less end up in an express care clinic or get admitted to the hospital or in the emergency room. It's very scary. It's overwhelming.
And so that feeds right into what Sunny was saying about education and preparation. So it's not like you're just all of a sudden doing something to an adult or a child. You have this tool to help them get prepared, and also the clinician to get prepared.
Correct.
So the certified autism centers, we talked about what they are. Why is this significant to our autistic population that are children, but also adults?
I think the significance is that because we are trained and we're certified, that we can meet you in the moment and where you're at and be ready to address your needs. We have these tools, so when you land here and you're scared, you might be traveling down I-12 and you end up in our emergency room, and our staff have these tools available to them to help you and really individualize your care. Like Sunny said, everybody is different, so we have a variety of tools so that we can really get you to communicate what's going on, and so we can put you at ease and really treat you. So
yeah, and one of those things is when you come in, if you come into one of us, say our pediatric clinics, all of our pediatric clinics have this sensory bag.
Correct.
Okay, and this is not for every single child that walks through the door, because every single child who walks through the door doesn't need it.
Correct.
Right?
Right.
But if you have a child who is autistic or is neurodiverse and maybe nonverbal or has sensory issues, tell me about this bag. I know how this bag came about, and it was fun, right?
It was fun.
Really fun to build and create. And you really managed to bring it all together into one. You identified what we would need and identified the needs of children and adults, and you came up with this. So tell me about it.
Sure. We had input from the communications team, from Sunny McDaniel. We looked and really talked about what should be in the bag. The bag needs to be for all age groups, so we needed to think about that. And kids need noise reduction. Sometimes they're sensory. The studio is very bright.
The light.
So light, and then depending on the age groups, I needed to be able to have a one-stop shop and anticipate a 3-year-old, 5-year-old, 17-year-old needing something. So they're adjustable. The sunglasses are kind of for smaller, but but we have different toys. So we have this is actually an oral toy for younger kids that would help. Right, and then we have different fidget toys depending on the age groups. There's more in the bag. There's more communication tools in the bag, and we actually give parents a copy of this guide and tell them how they can actually laminate and preserve it for themselves.
Amazing.
And we ask that they bring this to every single visit. Keep all these together in your little pack, and that way you're ready to. It's like a go bag if you have to seek out health care.
Yeah, because when we give them out, and we know who we give them to, and we ask you, like you said, to come back with them, because it's an investment. It's an investment, a worthwhile investment, and it's also something you're not just going to use in the clinic.
Right. It's something you can take everywhere. I love that it's striped, and so it's if you have it on your kid's back, there's reflectors so cars can see you. So your kid has actually ownership also and a partnership, because that's what we need. We need your kid to tell us what's wrong, and not a parent making an assumption, or we need everybody's input. So we want to give your kids some reduction in anxiety and stress, and let them know that it's okay to come to a healthcare provider in need.
That's right.
So
and it's got Sully on the bag.
It does. There's
original
our
Sully. So we're going to get an up close shot of this, but it's just it all is such an outstanding initiative. So these extra layers of education, the tools, how have they helped families from your view? Because I want to ask you about what families are saying to you, but I also want to say from your view, what kind of transformation have you seen?
I feel like our staff are confident to, again, meet you, whether, depending on where you enter, whether it's, at a surprise visit to the ER or if it's a scheduled visit to our clinic. Our staff feel empowered to really take the time they need. They have the resources they need to give you that individualized care and really get a good visit and really make a difference in a kid's life. You know, Sonny has shared with me some kids, because they are so sensory overloaded, they can never really get a full head to toe till they're 4, 5, or 6.
Yeah.
So, you know, every child at every stop needs a full exam, and so you've got to be able to reduce their stress, or
Right.
you know, so that you can care for them. So that's one of the reasons we're doing this. Is
Yeah.
we're trying to make a difference. We're trying to make sure we're available for all the age groups, like you said, and you know, we have a lot of support. So
Good. And so now let's talk about what you've heard from the community. Have you gotten feedback from the community? And what has that been like?
it's been great, right? It validates what you do, so you always want to make sure what you're doing makes a difference.
Sure.
But sometimes you just assume you're making a difference. So I do ask, I do know who receives the bags, and I keep a log. And so I do ask them, you know, what item was best. I talk to the staff and say, what item did the parent say was best for their child? What did you see the patient using? And so a lot of times it's the headphones, it's the fidget toys. They may have long waits, as you know, for test results.
Sure.
You may have to get admitted unexpectedly.
Right.
And if you know, hospitals are a 24/7, 365. There's lots of stimulations, beeps, noises, fresh staff coming in every 8 or 12 hours.
Right.
We've slept and we're ready to come take care of you. So that's a lot of stimulus. So that's what, you know, we hear from parents is, you're there, I needed it, I didn't anticipate being here, and I didn't have, you know, maybe they didn't have the noise
grab their little
right.
bag.
I don't expect you to be prepared all the time. You know, the other thing is what we've seen is accidents, car accidents, and you can't get that go bag because your car, you know, that's not the thing you're worried about.
Sure.
So they've ended up in our ER, and we have supplies. So that's the other good thing is, you know, just because you have these doesn't mean they're always on, you know, available.
Right,
So.
exactly. And we've talked a lot about healthcare, and we do have our pediatric clinics are certified autism centers. Our bone and joint clinic is a certified autism center. Our pediatric ICU and pediatric peds unit in the hospital are certified, and our parenting center.
Yes.
So it's not just about, you know, healthcare and the clinical setting. It's also about play with other children and interacting with other children who are not necessarily neurodiverse or autistic, but you're in that situation. So there's a lot going on.
There is a lot going on.
Yes.
So 4 of the 5 certified centers are clinical, but we have 1 non-clinical spot, and that's the parenting center here in Covington. And they have kids 4 and under, and it's an inclusive play area. We have activities, and we make sure that everybody feels welcome. And we have modifications to our activities, our craft days, our birthday parties. We can actually tell parents, you know, if they have a lot of sensory issues, you know, come at these times. That tends to be our down times. We have videos that you can watch ahead. I've heard Sonny plug the videos. We have videos so that you can watch with your child before you get to the parenting center. We have flip charts so they can see what activities are there. So it's just an inclusive space. It's a safe space. It's a place where you can come talk to other parents that, you know, have maybe sensory diverse children. So it's just a great place to socialize and feel supported. And, you know, it's a great resource for parents. So.
And to that point where you say parents, I feel like it's augmented the purpose of the parenting center even further.
And again, the parenting center, we have a specialist we have a dietitian who can help with food. We have somebody that has a master's in kinesiology. They're education based. We have a social worker. We're not a licensed center, but we can actually get you to resources and help you socialize and maybe give you some tips. So
that's awesome.
It's a great resource to have in our community. So very grateful for the hospital to have that.
Well, we're going to wrap up in a second, but I just wanted to give you the opportunity to add anything else you'd like to add.
Just grateful for all the support from the St. Tammany Health System Foundation, from the communications team, from Dr. Sonny McDaniel, Dr. McCall McDaniel, and their team. Sharing their expertise with us, getting us started on the certification, helping us create these tools, giving us insight. I encourage parents to go to the sttammany.health website /autism, use those resources, start looking at them, look at the videos. We're here. We're trying to make a difference. So.
Yeah. Well, thank you so much, Terri, for being here.
Appreciate it.
I appreciate it. And that is going to do it for this episode of Healthy Living. Everything we talked about you can find at sttammany.health. So please go and check it out, and we will see you next time on Healthy Living.